Okay, this right here is the aorta. This is the aortic arch. This down here, thoracic aorta down here. Okay. Branching off the aortic arch, you've got these two branches you can see pretty clearly here. Okay, this is the brachiocephalic trunk, the first one. This is the left subclavian, the second one. Left subclavian, you can even see go to the body wall here pretty clearly. Now, the other thing that's nice about this particular cat is you can see the brachiocephalic trunk and you can see it fork into three blood vessels right here. Okay. This one right here is going to be the right subclavian artery. This one's going to be the right common carotid. This one's going to be the left common carotid. And you can see the common carotids here and here. The subclavian is going to arch around in this mess here and then go to the arm, outside of the arm here. Excuse me. Okay. Now, when the subclavian comes out here, it's really difficult to see the difference between them here, but basically in this area you've got both the axillary artery and veins. Okay. And then this one right here, you've got the brachial artery and vein. Okay. Now, here's your superior vena cava. This branch of the superior vena cava is the brachiocephalic vein on the left side. There's the brachiocephalic vein on the right side. Okay. The external jugular vein goes into the brachiocephalic vein. Okay. So does the subclavian vein right here. Right here. Okay. Receives the blood from the brachial and axillary vein. Okay. Now the internal jugular vein is actually present here. It's right here. You see it go to the vein, and there's the artery. It's separate. So this is the internal jugular vein. This is the external jugular vein. Okay. Inferior vena cava. You can see really clearly right there. Go to the diaphragm there. Okay. Now it's going to come out the other side. Okay, so here's your inferior vena cava right here, coming out the other side. You can also see the big yellow vein right here, very clearly, about as clear as I've seen it so far. This is the hepatic portal vein.
Portal vein?
Portal vein.
Portal vein.
See how nice and yellow it is? It goes to the liver. The liver right there. Now you probably should be able to see it right here, but you can see it so clearly there, why would you want to dig for it? Okay. The abdominal aorta is going to be here. Okay, so you still got some stuff covering it. Okay, but the abdominal aorta is right here. Okay, and you can see the first two branches of it very clearly. This one is the celiac trunk. You can see it go this way, where the spleen, the stomach, and the liver are. Okay, so celiac trunk. This one you can very clearly see going over here, where the intestines are. So this is the superior mesenteric artery right here. Now what's going to be tough here, I guess you can see them both right here. Okay, you've got the big blue one, which is your renal vein. This little one right here next to it is the renal artery. Okay, and this is your kidney. You should be able to see them on the other side as well. Okay, so here's your inferior vena cava, here's your abdominal aorta. Okay, so actually it looks like the inferior mesenteric artery has been ripped off. I think that's the piece right there, where it ripped off, right there. Okay, now when we go down in here, okay, you should easily here be able to see where the abdominal aorta branches. Okay, this one right here is the external iliac artery. Okay, this one inside here is the internal iliac artery. The external iliac artery is going to go through the body wall. It should come out the other side in the upper leg. And when it does, I can't really separate it here from the veins, but it will go right here. This is where your femoral artery and your femoral vein are going to be found right here. Now, what's going to be difficult are the veins, the branches of the vena cava. The vena cava seems to be sort of more on this side, so I'm going to look on this side. It's not really dissected on this side. Alright, so the other branch right here, but this is where the inferior vena cava would fork, here and here. So this is going to be the common iliac vein. Now if you look right about there, the common iliac vein branches. Okay, there's one that goes down into the pelvis, that's the internal iliac vein. And then there's this one here that follows the internal iliac artery. So that's going to be the external iliac vein. Okay. And then when they both go through the body wall, you've got the femoral artery and vein here. Now notice the body wall has been cut, so you really can see that these are basically the same. They just changed names. Okay? That's it.
Oh, I'm so tired.